So this is just to kind of summarize, all of the ways that alcohol causes issues for a normal adult. Starting with the brain, it causes the degenerative changes. And so people that are alcoholics have smaller brains. I've got a great picture coming up. It can cause problems with your blood system. So when we check blood counts, we check a CBC. So you get a white count, you get an H&H, hemoglobin and hematocrit, and you get a platelet count. What do you think we see on that blood test? What do you think about the platelets? What's going to happen to the platelets in a chronic alcoholic?
Low platelets.
Exactly. Why is that?
Alcohol kills everything.
Well, so it's good. I'm giving you guys the keywords. That's good. No, so the liver makes platelets, okay? And so liver is not functioning as well. It's not going to make as many platelets. All right? What about red blood cells? What do you think about the H&H? What's your H&H going to be? Your hemoglobin and hematocrit. Low. Perfect. Yeah, this is good. You're using reasoning. I like it. You don't know the answer, but that's good. So it's going to be low because it suppresses your bone marrow. So alcohol, it kills things. It's direct cellular toxic in high levels. So chronic alcoholics have low H&Hs. They have low platelets. Okay? When you get your CBC back, that's normal. Cardiomyopathy. So chronic alcoholics, again, it's toxic to the heart. They tend to have big dilated hearts that don't pump as well. So they have it's called a cardiomyopathy when the heart doesn't pump as well as it should. Normally when the heart pumps, it gets around 70% of the blood out of the heart and into the circulating system. And somebody with a cardiomyopathy, they could have a depressed ejection fraction. It could be 40%, it could be 30%, it could be as low as 10%. They get fatty liver, which we've already kind of talked about. You can get hepatitis, which is more of an acute thing. So if you drink 20 drinks, and you really hit your liver really hard, you can get acute hepatitis where your liver gets really pissed off and inflamed and causes you to have a lot of pain. But more commonly, the chronic alcoholic, the drinker for 10 years that drinks a lot, gets cirrhotic, where their liver just scars down, becomes really small, and stops functioning. Mm-hmm.
Can you talk what fatty liver is opposed
to? So fatty liver is actually the kind of precursor to cirrhosis. So whenever somebody drinks alcohol, the way that the liver breaks it down through alcohol dehydrogenase and then further breaking it down from the acetaldehyde, fat actually infiltrates the liver. So if you do a biopsy on somebody that's just had a beer, there's going to be a little bit of fat in the liver. There's going to be fatty infiltration because of the way that the liver breaks it down. It actually takes a good week to clear that fat out. So most people drink socially, quote unquote, and if you did a biopsy of their liver and compared it to a non-drinker, somebody that completely abstained, they would look different, even if you weren't drinking to the point that the doctors and the CDC recommend is problematic. So it's just, it's a drug. It causes bad effects even if you're using it in moderation. So, just keep that in mind. It's kind of scary. But it's the same for Tylenol. I mean, Tylenol is a drug that's metabolized by the liver. And if you take Tylenol every day, like people that have arthritis, their liver is going to look different than somebody that doesn't take Tylenol either. Okay? So pancreatitis, we talked about that. You get impaired small intestine absorption. So people that are alcoholics, they talk about banana bags. You know what's in a banana bag? So banana bag is a bag of normal saline that you inject with a multivitamin and folate. Though alcoholics don't have as good absorption in their small intestine, they also don't eat as much. Like chronic alcoholics, they tend to just drink their calories. They don't eat as much. And so they're folate and they have vitamin deficiency. So banana bag, it looks yellow, it looks like a banana because of the multivitamin that goes in it. So you hang a banana bag on an alcoholic that's kind of withdrawing to try and replete some of their vitamins. They get testicular atrophy. That's actually really pronounced in end-stage patients. So Georgetown actually has a really great liver transplant program. We do a lot of liver transplants. And when you're on the wards, that's actually something you'll definitely notice. It's a really obvious physical exam finding. The testicles become extremely atrophic and pretty much disappear. You can't really palpate them. And then you also have the caput medusae. You can see it on their abdomen. And then they complain of rectal bleeding, for example, and you may do a rectal or just take a look and there's huge hemorrhoids. So those are the kind of external exam findings. They tend to also lose a lot of hair. Alcoholics, because of the hormone changes, they lose a lot of hair on their legs and on their stomach, in men and facial hair. So this is a brain on alcohol. The normal brain on the left, you can see, this is probably the brain of like a 25-year-old or so. Unfortunately, DC is a big city. We see a lot of homeless people that are alcoholics for whatever reason, for the social issues that they have. Alcoholics tend to fall, so they come to the emergency room. When they fall and hit their head, we do CAT scans to make sure they don't have any bleeding. And so this is a CAT scan of somebody that may be 35 years old on the right with huge ventricles. So these are the ventricles where the CSF circulates. Normally you want to see what we see on the left, where the ventricles are pretty tiny. So these are probably the same age person, but this person drinks, 5 or 6 drinks a day, lives on the street, or may not live on the street. They may, be a very high functioning alcoholic, but their brain is slowly atrophied because of the amount that they're drinking. So this is a legit picture of the brain of an alcoholic and the brain of a non-alcoholic.
If the alcoholic stops drinking, will the ventricles become more narrow? Or
the brain has very little regenerative capacity, right? So the one organ that has regenerative capacity is actually the liver. So alcoholics that stop drinking, can save their liver. They oftentimes can't save their brain. So luckily we have redundant brain, right? A lot of the brain we have, you don't necessarily, you can still be really high functioning, but there's no way really to get the ventricles to fill back in. So we talked about alcohol for everyone, and then we've talked a little bit about alcohol in the mother, but just to summarize, it increases the amount of nitric oxide, the free radicals in the mother. It also increases prostaglandins in the uterus, and so there are a lot of issues with maternal fetal circulation. So the uterus becomes a little bit harder in women that are alcoholics, so the blood flow to the fetus tends to be a little bit lower. It lays down extra collagen and elastin, so again, it decreases circulation, so there's not as much blood flow getting to the baby. And I touched upon this a little bit, but some of the new research on fetal alcohol syndrome has really shown that there's reprogramming of the endocrine system. So the way that alcohol affects the mother's hypothalamic pituitary axis can really impact the baby system and the way the baby develops. So steroids are really important for the developing fetus. And so some good research going on in Canada right now is trying to figure out what's happening with the HPA in alcoholics or in mothers that drink during pregnancy and how that impacts and gets you to actual fetal alcohol syndrome. So how is alcohol different than other drugs? In the 1980s, I think, I was fairly young, but they talked about crack babies. Heard about that? So there was a prominent researcher that was studying a lot of children that wound up in the NICU, born to mothers that were addicted to drugs, and they kind of coined the term crack babies because the moms were admitting that they were using cocaine, crack cocaine. But what do most people do when they're using drugs?
They drink and smoke with it.
Exactly. Gateway drugs. So that's like a legitimate thing. Kids that use marijuana are more likely to do drugs as they get older. So gateway. If you drink in high school, you're more likely to try something more extreme in college. And so people that use cocaine are also going to be probably drinking. And so the problem with these studies that coined the term crack baby is that they weren't taking into account that these mothers were also drinking a ton and they were smoking a lot. And so a lot of the kids that wound up having problems, these NICU babies, a lot of it was actually linked to alcohol. It's hard to tease out because it's really impossible to do studies when you don't know what the patient did. There's a lot of reasons for them not to tell you exactly what they did. But fetal alcohol syndrome is a syndrome that we can diagnose based on facial features. So we know that there were a lot of confounders and alcohol played a big role. The bottom line with most illegal and illicit drugs is that the adverse effects that they have on prenatal exposure tend to be fairly self-limited. So they may be born smaller than babies that weren't exposed to illicit drugs, but there can be some catch-up period. And if you take babies that were born to mothers that were addicted to heroin, for example, and you put them in good families if they're adopted, then they tend to kind of catch up by the time they make it to second and third grade. Most studies show that if they have a good support structure, they tend to do very well. And the one exception in all of this is alcohol, and that's because we know, as we've talked about over the last hour, that alcohol causes direct cellular effects, that it can cause cells to die and can cause them to migrate to the wrong places, and so it causes lifelong impairments. So back to our case, so the case that we started with, and what I see on a frequent basis. So we have an 18-year-old that's complaining of abdominal pain but is pregnant, is possibly at risk for miscarriage. 18-year-olds tend not to know a whole lot about pregnancy, so we need to tell them to take their prenatal vitamins, tell them not to drink alcohol, not to use illicit drugs, not to smoke, and that it's really important that they follow up with an OBGYN. Okay? So to kind of summarize everything, I want to have some takeaway points. So we have 101 things, it's not really 101, but some key take-home points about FASD to start the class, okay? Alcohol use in pregnancy is the leading known cause of preventable mental retardation in the United States. So let's think about that for a second. Preventable mental retardation. So there are lots of causes of MR. Not all of them are preventable, right? Down syndrome, very common. Can't really prevent it. It's a chromosomal abnormality that at this point we don't know how to tell that chromosome not to be a trisomy. We do know how to prevent mental retardation when it comes to alcohol. All you have to do is not drink alcohol. So it's really, really easy, really preventable. We have FAS, which is a syndrome that you can write on a chart and say this child has fetal alcohol syndrome. We also have FASD, which is everything else. If a child was exposed to alcohol in utero and they have a subtle cognitive issue, that falls under the umbrella of fetal alcohol spectrum disorder. It's a term that describes the wide range of effects that can happen to a baby when the mother drinks during pregnancy. Make sense? FAS is the disorder of permanent birth defects that includes the brain damage, the growth deficit, so less than 10% at birth or less than 10% along the curve, with the facial features. And what are some of the facial features?
Indistinct filtrum.
Good. Philtrum.
Thin lip.
And the thin lip. Good. And they tend to have flattened face, small eyes. So as I said before, FAS and FASD, they're 100% preventable, but once you have it, we don't have any indication that there's a treatment. Now, all the data that we talked about before, the talk about the apoptosis, the cell necrosis, the programming of the HPA axis, the vitamin A issues, there are a lot of people out there that are looking for treatments that are trying to come up with ways to prevent it to treat it once you have it. But at this point, there's nothing. There's absolutely nothing. There's nothing on the horizon. So we have to prevent it so that you don't get it. So to speak in terms of numbers, FASD, which is the broad umbrella term, that's around 40,000 babies every year, or 1 in 100 live births. Children are affected by this. That's more than a lot of other more kind of common, more talked about issues. Now, not to say these aren't important, these are extremely important, but it's important for doctors to know that we have the power to prevent this. It's more common than spina bifida, than Down syndrome, than muscular dystrophy, than all of that combined, and it's preventable. And that being said, the research on this is pretty low, and part of that is because it is preventable. So why would you research a cure if you know how to prevent it? Well, you research a cure because not everyone is on the same page. Again, this gets to the baby blogs. People are out there fighting, I can have a glass of wine at night, it's not a big deal. So research papers on FAS are roughly 80% fewer than that for Down syndrome. The cost is pretty steep. It's about $5.5 billion a year just to take care of kids with fetal alcohol syndrome. Fetal alcohol syndrome is it's a fairly severe set of deficits, right? It's the facial features, the small growth, the cognitive delays. And so they require a lot of services. They require a lot of healthcare services, direct healthcare services. They go to see a lot of specialists. But then they also need physical therapy. They need help getting to and from school, to and from work. They need one-on-one attention in school. So there's a lot of social costs associated with it. Alcohol-related disease is extremely expensive. So all of the issues we talked about with the brain, with the liver, with the pancreas, with the long-term effects of alcohol, that's roughly $185 billion a year. Does anybody know how big the U.S. healthcare economy is? It's about $2.7 trillion. That's the size of the U.S. healthcare economy. That's the same size as the entire country of France GDP. So we spend a lot of money on healthcare in this country. We spend, everything in France is equal to the United States' healthcare, all of their wine and their tourism and their everything. So politicians are trying to find out ways to save money, and this is obviously one of many perfect places to save money. We create a lot of problems for ourselves, and drinking and pregnancy is one of them. $5.5 billion on a disease that's totally preventable. And then almost $200 billion on diseases for adults that are totally preventable. Diabetes is just the same. How do you prevent diabetes? Type 2 diabetes.
Exercise.
Yeah, so if you're thin, you probably aren't going to be a diabetic. Now, some people are born with diabetes, and that's type 1 diabetes. That's totally different. That they're born with a pancreas that doesn't produce insulin. But type 2 diabetes is often when you go for a long time, eating a lot of sugary things, you burn out your pancreas, you get type 2 diabetes. And that's right up there with the cost of alcohol-related disease. It's roughly $200 billion a year as well. So preventable diseases are very expensive in the United States. 60% of individuals that have FAS are going to require some sort of institutional support. Unfortunately, a lot of kids that have issues in the United States wind up in incarceration, they wind up in a mental health facility, and that's extremely expensive as well. In 1996, the Institute of Medicine published a report. They said of all the substances of abuse, including heroin, cocaine, marijuana, alcohol produces by far the most serious neurobehavioral effects on the developing baby. So this is just to say that the medical community, the Institute of Medicine, which is the highest medical body in the United States, they really recognize that this is a serious issue. However, if you look at the survey data that classes in the past have done, that big researchers have published, doctors don't always say to their patients that this is dangerous and you probably shouldn't do it. One study found that 70% of children in foster care have had prenatal alcohol exposure, so the foster system is very affected by it. So the Surgeon General, the Chief Doctor of the United States, recommends pregnant women should abstain from alcohol for the entire duration of their pregnancy. And that's on alcoholic containers. Have you seen them? I mean, it's in bars, it's on beer bottles. And yet, if you look at survey data, there are plenty of surveys of healthcare providers that show there's a serious disconnect from what the Surgeon General says, from what the Institute of Medicine says, and what actual clinical practice, what happens in real life. And it's equivocal. You go to your doctor, you say, what should I do? Should I stop? Well, probably, but is it going to hurt? Maybe not. That's a very common answer. And that's something that you hear quite often. And if they're not doing that, then they're probably just not providing any counseling at all. So that's where this class is really important, so that we can all go out and tell people that it's dangerous and tell your friends that it's dangerous and be safe. So in conclusion, this is pretty much what pregnancy is all about. And I can speak to it because I'm living it right now. So that's kind of the FAS overview. Do you guys have any questions? All right.